Every day, women are juggling so many things: our careers, chasing our dreams, taking care of our friends and families. There's often one thing, though, that we neglect, and that is our health, which is sometimes the most important thing. But that's all about to change today. It's all about women today on today's episode. We're going to focus on women's preventive health today, from regular screenings like pap smears to mammograms and essential vaccinations. We're going to discuss it all and give you the 411 on what every woman needs to know for her health. We're also going to answer your health related questions here on today's episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we answer your health-related questions. I'm Dr. Kamaljit Kaur, a primary care physician here in Coral Springs, Florida. Today's first question comes to us from Whitney, and she reached out to us through our website, allhealthtv.com. Let's get to Whitney's question. Hi, Dr. Kaur. How often should a woman get a pap smear test, and what should they expect both during and after the exam? And FYI, I'm asking for a friend. I hope that your friend is feels as fortunate to have such a good friend as yourself. But if you're asking for, somebody else, it's also very important. Thank you for your question, Whitney. But before we move into the answer, let's watch this video from our friends at the Mayo Clinic.
And I always talk to the patients first, show them the instruments we use so they're comfortable, and what to expect. And then when I do the pap smear, I talk them through that, and make sure they're comfortable. And if they're having pain, we always adjust accordingly. But really, it doesn't take a long time, but it's a good test to go through. Sometimes we do bleed after pap smears for a few days, and you shouldn't worry about it. Yeah, sometimes you could take some anti-inflammatory medication like Advil, Aleve, or ibuprofen. That might help a little bit.
That was a great informational video from our friends at the Mayo Clinic. Now, before I go a little into the details of answering your question, I'd like to back up and talk about pap smears just for a second, because a lot of us aren't familiar with pap smears, and a lot of us may not even have had one yet. So for those of you who aren't familiar with a pap smear, this is basically a test that we use to screen for cervical cancer. And the guidelines have changed over the years on when to start pap smears, how often to do the pap smears, and what kind of testing to do even. And really, this depends on a lot of things, including your personal health history and your health risk factors. So you definitely want to talk to your primary care physician or your gynecologist about what's appropriate for you. Now, before a pap smear, your gynecologist or your physician may give you instructions or recommendations on things to avoid, such as vaginal creams, vaginal douching, and sometimes even vaginal suppositories that you may be using for other medical conditions, and even some certain activities. Certain physicians may recommend avoiding sexual activity in the days before your pap smear, basic things like that. Now, in addition to what you should do before your pap smear, there's also recommendations sometimes for care afterwards. Now, this is generally a painless examination. It can be uncomfortable, but generally it's painless, and you will normally resume your normal activity afterwards. It's not like a surgery or an invasive procedure where you're going to need some downtime or anything like that. And just like Dr. Bance was saying in the Mayo Clinic video, there are things that we can do to make the exam more comfortable, such as selecting a certain speculum size, or having you maybe take some anti-inflammatories beforehand to reduce pain. But all those recommendations are really going to depend on a variety of factors, so do talk to your physician for it. And like I mentioned, the guidelines have changed on when to start pap smears. Certain societies recommend starting at age 21, and certain societies recommend starting at age 25 now even. But regardless, once you start to get around the age of 20, 21, please do talk to your physician about when is the appropriate time for you to get started. Now, the other thing that I want to mention about pap smears is that how often they're done, those guidelines have even changed. So, a lot of us grew up thinking it has to be done every year. Now, it can be sometimes every 3 years or even every 5 years, depending on the type of testing that's done. So, those are some of the details that I think everybody should know about when to get their pap smear and how often they should expect it. Let's get to our next question. This one comes to us from Esther. Esther reached out to us from Facebook and she writes, "Hey, Dr. K, my dear friend is 2 months pregnant and has been bleeding for 6 days now. That's not normal, is it?" Oh, Esther, I'm so glad that your friend has you in her life to care for her like this. And honestly, that's not normal. Although certain types of bleeding during certain times of pregnancy may be common, it's not always absolutely normal. Before I get into the answer, I do want to encourage you to encourage your friend to see her obstetrician as soon as possible. And I can't really diagnose without seeing her in person myself, but she should get it looked at so they can undergo the investigation and make sure that it's just something that's benign. Now, like I said, while some bleeding might be common during the first half of pregnancy, it can still be a sign of something more malicious going on. It really depends on the timing of the bleeding and the type of bleeding that the woman is experiencing. But like I said, it's of the utmost important that your friend sees her obstetrician and they can begin evaluating what's going on. We have another question, and this one comes to us from our website again, allhealthtv.com. And this one is from Carolina. Carolina asks, "Hola, doctor. What are the benefits and limitations of self breast exams, and how do you know if you're doing it correctly?" Hola, Carolina. That's a great question. But before I respond, let's check out this video from our friends at Baptist Health.
Hello, I'm Dr. Anaisis Ballesteros with Baptist Health Primary Care. When it comes to breast cancer, catching it early is the key for a positive outcome. For this reason, adult women are encouraged to perform breast self-exams at least once a month. Not only can self-exams help you to detect a lump or irregularity, it can also help you become familiar with how your breasts look and feel, so you can alert your healthcare professional if there are any changes. Contact your primary care physician for tips on how to perform a self-exam.
Now, just as Dr. Ballesteros said, self-breast exams are quite important for helping us detect any abnormalities that we feel in the structure, the shape, and the texture of our breasts. I'm going to say something a little bit that might be controversial and something that I'm sure a lot of you have heard from your gynecologist. In the old days, years ago, it was recommended to do self-breast exams every month. And then most recently, guidelines changed, whereas they're no longer being recommended because not apparently, there was some data that showed they're not as beneficial in detecting things that are truly malicious and truly going to cause disease. And there was findings that women were coming across during these self-breast exams that were really just raising a lot of angst and stress and putting them through unnecessary procedures, honestly, all for nothing, which is a good thing, right? It turned out to be nothing. So that being said, and I'm mentioning this because I know a lot of physicians differ on their stance on this. That being said, I always tell my patients, the guidelines are there just to make recommendations and to guide us, but you know your body best. You and your physician will have the discussion and decide if this is something that you should be doing on a regular basis or on a monthly basis. If you do perform self-breast exams, because yes, a lot of us still do, there's a certain way to do it. And there's not like a perfect way to do it, as long as you're feeling every inch and every as far down as you can go, every part of your breast, and you know your body best. You do it regularly enough, you're going to get an idea of what feels normal to you. And the way to do that is to go around different parts of the breast using your 3 middle fingers. And you want to use the pads of the fingers, not the fingertips. And you want to have some slight pressure and then a little bit deeper pressure, just so you're feeling everything appropriately. No matter how you do it, no matter how often you do it, anything that seems abnormal to you, please do talk to your physician about it so you can get it investigated. Because at the end of the day, what we're trying to do with this is to prevent breast cancer or to help detect breast cancer. And the earlier you detect it, the higher your chances of treating it and curing it. So keep that in mind. Now, in case you missed it the first time, here's how you can send us your health-related questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, now we're firing on all cylinders and we have more questions coming in. So let's get to the next one. This one comes to us from Rana, and Rana asks, Namaste, Dr. Kaur. It's difficult enough being 6 months pregnant, believe you me. But now I also have a 4-millimeter gallstone to contend with. My question is this: what can I eat and what shouldn't I eat? Namaste, Rana. My heart goes out to you. I'm so sorry. Sometimes just being pregnant is difficult enough, but now to deal with the gallstone on top of it, I'm sure that's not only uncomfortable, but that's also causing you some level of stress and anxiety. And I appreciate you sharing your story with us. So let me give you some tips and hopefully I can help alleviate some of that stress for you. Now, while it may not make you feel better, I hope it's reassuring to you to know that gallstones are more common in pregnant women than in non-pregnant ones. You can blame this one on the increased hormones. I mean, we blame a lot of stuff as women on hormones, but sometimes it's actually true. Those reproductive hormones that are running through your body at increased levels right now can cause you to form gallstones. However, even though this can be common, it does still present an increased risk of complications to you and to your baby during pregnancy. So it's really important to take measures that you can to help mitigate the condition and to help prevent those complications. You may be actually surprised to know that intake of dietary fat, even though we think of it as something that is really, really impactful for gallstones, studies have shown that it really doesn't matter how much dietary fat you're intaking as related to the gallstone formation in a pregnant woman. However, you still want to follow a healthy diet. That doesn't mean, eat all the fatty foods that you can. You still want to minimize your intake of fatty foods, especially saturated fats. You want to eat healthy fats like avocados. You want to eat a healthy plant-based whole foods diet. Avoid those processed foods. Make sure you're getting a lot of fiber in your diet as well, because that's always good. And you also want to make sure that you're maintaining a healthy weight, you're exercising if it's safe for you during your pregnancy. And at the first sign of any kind of abdominal discomfort, you want to notify your physician right away. I hope you have a healthy and successful pregnancy. All right, friends, it looks like we finally have a question from YouTube, and this one comes to us from Iris, and Iris asks, Hey, Dr. Kaur, at the age of 45, I think I may be a little late to the party, but when should women start getting mammograms? And how often should they have them based on current guidelines? Hi, Iris. Don't worry. Never late, better late than never, right? That's the saying. Welcome to the party. We're glad you're here, and let's give you some tips to really get things going. Just like with most other cancer screenings, the major medical societies have different recommendations on this one. So notably, the American College of Obstetrics and Gynecologists and the USPSTF and the American Cancer Society recommend starting anywhere between the ages of 40 and 45. There's a lot of details that go into when your exact age to start should be. And just like with everything else, this depends on your health history and your personal risk factors. But at least starting the conversation at 40 is recommended for every woman with her physician. And then after that, your physician and you will sit down and decide what age and what modality is the most appropriate for you. Now, sometimes because of a high risk due to family history, a gynecologist or your physician may even recommend that you start sooner than 40. So definitely talk to them. And then we have the starting age, but then we also have how often do you do the mammograms and other breast imaging, because there's also ultrasounds and then there's also breast MRIs. So how often do you do them? Now, it used to be every year. And then in the last several years, those guidelines have changed to every other year, so every 2 years. No matter what, always sit down with your physician, talk about your personal risks and your current health and your health history and your family history to determine what is appropriate for you. All right, we've got another question from allhealthtv.com. You should really check out our website if you haven't. It's got a lot of really good information and health tips, and I'm sure it can only help. This question comes to us from Rowena, and Rowena asks, Doctor, I don't have any symptoms other than a tingling in my hands and a burning sensation in my legs and feet. But does that mean I could be diabetic? Hi, Rowena. Thank you for sending in your question. Based on your symptoms, you may actually have what's called diabetic neuropathy. Now, uncontrolled diabetes and chronically high levels of glucose or sugar in your bloodstream, can wreak havoc on various parts of your physiology and your system. And one of the parts that is affected is your nervous system and your nerves. Those high levels of sugars basically cause a lot of inflammation and damage to the surface of the nerves and to their functioning. And this results in some of the symptoms that you're talking about. Now, this topic is so important that I decided to put together a list for you and our other viewers. So let's go through them. Some of the signs and symptoms of diabetic neuropathy are, number one, pain and or discomfort in the arms and or the legs. And this is because of the nerve damage. Number two, not being able to feel sores and cuts. So if your nerves are damaged, you can't feel pain. So if you get a cut, you may not even know that you have it. Number three, sleep issues. Number four, bloating and indigestion. Number five, intolerance to heat. And number six, problems with walking because your nerves are damaged, so your balance receptors may be damaged as well, and then that causes an imbalance and inability to walk appropriately. You may also have diarrhea. Number eight, you may also have problems urinating. And number nine, you may experience sexual dysfunction. Now, neuropathy can also be due to a variety of other conditions, so do check in with your PCP to begin investigating your own symptoms. All right, looks like we got another question from the Instagram, and this time it's from Marcia, who asks, Dr. Kaur, I know that menopause is lurking right around the corner. So in an effort to be proactive, I'd like to know about the risks and benefits of hormone replacement therapy as one goes through menopause. I'm so happy to hear that you're advocating for yourself, and it's so important. So menopause is a complicated stage of life for women and others around them, let's be honest. Due to the change in your reproductive hormones, your body goes into flux, producing a variety of symptoms and physiological changes. Some women may experience horribly life-invading symptoms like hot flashes or inability to sleep, and others may have only minimal symptoms and really not have much problem going through menopause, believe it or not. Whether or not to use hormone replacement therapy really depends on your symptoms that you're experiencing, your medical history. For instance, do you have cardiovascular disease? Do you have a history of other types of cancers? And really, what is your risk of breast cancer overall? The type of hormone replacement therapy that you'll be prescribed depends on these factors. You may only receive estrogen. You may receive a combination of estrogen or progestin therapy. And really, each has its own risk factors and its own benefits. For instance, some of the risk factors associated are coronary artery disease, blood clots in the lungs, increased risk of breast cancer, endometrial cancer, and ovarian cancer, depending on the type of hormone replacement therapy that you're given. That's why it's really important to talk in detail with your physician about the type of replacement therapy you're being given, what your risk factors are, and what are your potential complications from these medications. However, hormone replacement therapy also has its benefits. And of course, some data shows that the combination hormone replacement therapy has been shown to reduce risk of diabetes, risk of recurrent UTIs, and let's not forget the improvement to quality of life, right? I mean, like I said earlier, some of these symptoms are really life altering and life invading. So if we can alleviate some of them, then that's, I always want to improve a person's quality of life, but doing it safely is very, very important. So please keep that in mind. Now, if you've got questions, we've got answers. In case you missed it the first time, here's how you can send us some of those questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We've got our first question from a man today. That makes sense that we haven't heard from many men yet, so I'm glad one of you chimed in. Thank you. This comes to us from Moro, and Moro reached out to us from his YouTube page, and he asks, Doctor, what, if anything, is the difference between ADD and ADHD? My wife, Naira, accuses me every other day of having either one or the other. Moro, thank you for writing in and sharing your story with us. I can't help but be curious what it is that's making Naira feel like you have one of these conditions. But let's get into details a little bit. Now, just like the guidelines for cancer screening change, so do the names and the diagnostic criteria for some other health conditions. And ADD is one of them. ADD is the old term, and it used to stand for attention deficit disorder. The term needed to be updated, and it now is updated to ADHD, which is attention deficit hypersensitivity disorder. And the reason they made that change is because the old term didn't include the hypersensitivity portion of it, which is important in the diagnostic criteria for this condition. So ADHD is the official name that's given to the set of symptoms that may include difficulty concentrating and or impulsive behavior. It takes a lot more than that to formally diagnose somebody. So if you and your wife have true concerns, please do voice them to your primary care physician so you guys can sit down, have a detailed discussion, get an appropriate diagnosis, and then more importantly, get it managed and get it treated so you can optimize your quality of life. All right, we've got back-to-back questions from YouTube, and this one is from Boha. And Boha asks, hello, Dr. Kaur. I know this question may be a little off topic, but I think you're a very talented physician, so I'm sure you know the answer. Is mild bilateral conductive hearing loss curable? Well, first of all, Boha, thank you for your kind words. I'm very humbled. And thank you for your question. So let's talk a little bit about it. Hearing loss can be such a life-altering symptom. I mean, it's one of your five senses. So if you lose it, it really impacts your life, needless to say. However, it may be cured depending on what's causing it to begin with. For instance, if your conductive hearing loss is being caused simply by a buildup of earwax, well, we can take care of that. Just remove the earwax as best as we can and take it from there. There may be other issues like a foreign body in the ear or a ruptured eardrum. That happens as well. So the first thing you want to do is check in with your physician to see what's causing your hearing loss and take it from there. But I don't want you to be dismayed because often conductive hearing loss can be either fully cured or significantly improved. All right, let's see. The questions just keep coming on in. And we have one here from Bettina. And Bettina asks from Facebook, Doctor, what are the common misconceptions about pap smears that women should be aware of? Well, Bettina, one of the most common misconceptions that I get in my practice, especially for women who are going to have a pap smear for the first time, are that this is a painful procedure. And sometimes they even avoid doing it because of that misconception. So I do want to reassure everyone out there that when it's done appropriately, a pap smear is generally a painless procedure. Yes, I'm not going to lie, it is uncomfortable, but there are ways to make it a little bit more comfortable. Like I mentioned before, choosing a good speculum size, maybe having some analgesics beforehand. But it is something that is a very important screening tool to do. So if you're at all hesitant, please do sit down with your primary care physician or your gynecologist to talk a little bit more about it. Now let's move on to our next question. And this comes to us from Krista through allhealthtv.com. Hi, Dr. Kaur. What are some effective strategies for maintaining mental health and preventing anxiety and depression during menopause? This is something that we see quite often. Now, with that flux of hormones running through the body, some up, some down, some changing, most of them changing actually, right? This causes a lot of different symptoms in a woman's body. We mentioned hot flashes earlier. Difficulty sleeping is definitely one of them. Difficulty concentrating can be one of them. Memory issues can be one of them. Weight gain certainly is a very commonly related menopausal symptom. But a lot of people don't know that mental health can also be affected during menopause. And yep, you can blame those hormonal changes to this because you're having higher amounts of certain hormones running through the body, and that can negatively impact a woman's mental health and increase symptoms of anxiety and the symptoms of depression. This can be mitigated and managed in a few different ways. And honestly, the first thing you want to do is make sure you're leading a healthy lifestyle. I know I say it a lot, but it truly, truly is the foundation of minimizing a lot of health conditions. So you want to make sure you're eating a nutritious diet, you're sleeping adequately, you're exercising regularly as much as you can. And then on top of the lifestyle changes, you can also implement some medications with the guidance of your physician and sometimes support groups. I mean, believe it or not, it does help. So I hope that that's something that you can take advantage of because I know mental health and menopause really do go hand in hand. Well, folks, that's really all the time that we have for today. I loved going through your questions because they also remind me how important it is to educate everybody on certain health conditions, how to treat them, how to prevent them, and really to get to know what we can experience, especially as women. We put ourselves behind all the time. So it's important to think about ourselves too, right? Thank you so much, everybody, for tuning in. I hope you've enjoyed the show, and I'll see you next time here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.